New this morning, the U.S. Surgeon General wants to put a warning label on social media platforms, similar to the ones you may see on a box of cigarettes. In the New York Times over the weekend, Dr. Vivek Murthy says the label would state social media is associated with significant health harms for kids and teenagers. A clinician at Pine Rest Christian Mental Health Services says a label is a good step, but more needs to be done.
I think it'd be really important from that sort of warning to come out with more interventions, more supports, more clear guidance for parents.
Well, social media isn't the only factor. Dr. Heidi Rawlings says it's a big one. She says she is seeing more depression and increased risk of suicide among young people. Since COVID, Dr. Rawlings says they've been wondering if social media has a role in those increases.
Sometimes myself and other clinicians I work with will ask youth if social media is playing a role or if it contributed. And we are noticing that sometimes those are connected. For example, they may see distressing content online.
Dr. Rawlings recommends parents approach the topic with a curious and non-judgmental approach. She says ask your child what type of sites they visit and if anything is making them feel uncomfortable. She also recommends monitoring their time spent online. Pine Rest also has more resources on this topic. You can find that by clicking on this story at 13onyourside.com. We should also mention the Surgeon General's recommendation is only just a recommendation at this point. No action has been taken by Congress.